Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Hiccups. Introduction. A hiccup is an involuntary movement of the diaphragm. The diaphragm is the muscle at the base of the lungs. The movement is followed by quick closure of the vocal cords, which produces the hic sound you make. Hiccups usually are not serious, but rarely, ongoing hiccups can be a sign of a medical problem. This program explains hiccups. It covers causes of hiccups as well as diagnosis and treatment options. What are hiccups? All hiccups start with the diaphragm. The diaphragm is a dome-shaped muscle that sits below the lungs. When you breathe in, the diaphragm pulls down. This helps draw air into the lungs. When you breathe out, the diaphragm relaxes. The air can then leave the lungs through the mouth or nose. Hiccups can happen when the diaphragm becomes irritated. If this happens, the diaphragm pulls down sharply. This pulls air into your throat, causing the air to hit your voice box. The result is called a hiccup. You may also experience a tight feeling in the abdomen, chest, or throat before a hiccup. Most of the time, hiccups last only a few minutes. Contact your healthcare provider if your hiccups last for more than a couple of days. Having hiccups that last a long time can interfere with sleeping, eating, and breathing. They can lead to exhaustion. Causes. Many things can irritate the diaphragm and cause hiccups. Some of these include drinking alcohol or carbonated beverages, eating hot or spicy foods, eating large meals. Other possible causes of hiccups include being excited or stressed out, temperature changes. Hiccups may also start and stop for no obvious reason. If hiccups last longer than 48 hours, there may also be other causes, such as an underlying medical condition. Long-term hiccups may happen as a result of damage to or irritation of the nerves that lead to the diaphragm. Nerves that lead to the diaphragm may be damaged or irritated by a tumor or other abnormal growth in the neck, acid reflux, something in the ear touching the eardrum, sore throat. Damage to the brain can also cause long-term hiccups. Damage may be due to inflammation of the brain or the tissues surrounding the brain, multiple sclerosis or MS, stroke, tumors, traumatic brain injury. Other possible causes of hiccups include diabetes, kidney disease, taking certain medicines such as steroids. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis. Most cases of hiccups only last a few minutes. If this is the case, you do not need to consult a healthcare provider. You should talk to your healthcare provider if your hiccups last more than a couple of days. This can be a sign of an underlying medical condition. Your healthcare provider will first ask about your medical history and symptoms. A physical exam will be performed. Your doctor may run blood tests. Imaging tests may also be done. These tests can show if there is an abnormality with the nerves or abdomen. The tests may include chest x-rays, CT scan, MRI. In some cases, an endoscopy may be done. This test involves using a thin, lighted tube inserted into the mouth and down the throat. This can check for problems with the trachea or windpipe. Other tests may also be needed. Talk to your healthcare provider to learn more. Treatment. Usually, hiccups go away without any treatment. If you have a medical condition that is triggering hiccups, treating that condition may make them go away. There is no sure way to stop a short episode of hiccups. You can try holding your breath, breathing into a paper bag, drinking or sipping a glass of cold water. For long-term hiccups, treatment may include medicines, surgery, other medical procedures. A variety of medicines can be used to treat long-term hiccups. Talk to your healthcare provider about the different types of medicines available and which one could work best for you. In some cases, surgery may be done to place a battery-operated device in the chest. This device delivers mild electrical stimulation to the vagus nerve. Your healthcare provider may also recommend an injection of an anesthetic near the phrenic nerve. The phrenic nerve passes from the neck down to the diaphragm. The injection can block your phrenic nerve to stop hiccups.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A hiccup is an involuntary movement of the diaphragm. The diaphragm is the muscle at the base of the lungs. The movement is followed by quick closure of the vocal cords, which produces the hic sound you make. Hiccups can happen when the diaphragm becomes irritated, such as by eating large meals or foods that are spicy. Hiccups may also start and stop for no obvious reason. Usually, hiccups go away without any treatment. You can try holding your breath, breathing into a paper bag, or drinking a glass of cold water. If you have a medical condition that is triggering hiccups, treating that condition may make them go away. Hiccups usually are not serious, but rarely, ongoing hiccups can be a sign of a medical problem. Contact your healthcare provider if your hiccups last for more than a couple of days. Thank you for using Explain.